In this animation, we would like to tell you more about the gastric bypass operation, which is performed to treat severe overweight or obesity. The operation is performed through minimally invasive surgery. This makes the operation safer and will speed up the recovery after the surgery. Small tubes are placed in the abdomen. A camera is inserted through one of these tubes. The other tubes are used for instruments to perform the operation. It is important to follow your practitioner's diet and lifestyle advice prior to the surgery. This will reduce the amount of abdominal fat, strengthen the intestines, and make the liver smaller. This makes performing the surgery safer and will reduce the likelihood of complications. By performing a gastric bypass operation, the stomach is divided into two parts: a reduced stomach, also known as a gastric pouch, and a large stomach. Food enters the gastric pouch. This usually makes you feel full faster. The food will no longer enter the large stomach, but it is still important for creating digestive juices. Afterwards, the small intestine is divided and connected again to the gastric pouch. The small intestine that is still attached to the large stomach is then connected to the small intestine attached to the pouch, allowing the food to come together with the digestive juices. After a gastric bypass operation, the food reaches the small intestine much faster. Therefore, it is important to eat slowly after the operation, chew very well, and choose the right food products to prevent problems. Please follow the advice of your practitioner. After the food is swallowed, it passes through the esophagus and via the gastric pouch, it reaches the small intestine. The digestive juices will reach the food through the large stomach and the first part of the small intestine. From this point on, the digestion of the food and absorption of the nutrients will begin. A gastric bypass operation improves your metabolism, usually resulting in less feelings of hunger and faster satiety. However, for permanent weight loss, a good lifestyle will always remain essential. Besides weight loss, other diseases or complaints may improve after a gastric bypass operation. These include high blood pressure, type 2 diabetes, elevated cholesterol, and cardiovascular diseases.